Good afternoon, ladies and gentlemen. My name is Seung-Jun Oh from Seoul National University Hospital. Dr. Yu couldn't come here. I have nothing to declare. We all know that bladder outlet obstruction in BPH patient may cause compensation and decompensation mechanism changes of the bladder, and the urinary retention may create a myogenic overdistension injury of the bladder. So our hypothesis is that urinary retention may put a negative impact on this surgical outcome of prostatectomy in a BPH patient. So we try to evaluate the effect of urinary retention on surgical outcome after Holep for Lutsbph patients. So the subject of this study was from SNUH BPH database registry. This is a prospective cohort study, and the Holep was performed for 7 years. And the patient inclusion criteria was BPH patient aged over 50 years, and we excluded genitourinary cancer and the patient with a previous history of pelvic surgery or any patient with neurogenic bladder. So we identified 903 patients. And the definition of a urinary retention is acute urinary retention is defined as a sudden spontaneous onset of being unable to pass urine, and the chronic urinary retention was defined as non-transient voiding difficulty with a PVR more than 300 milliliter. And the Holep was performed after spontaneous voiding, at least a small amount was demonstrated, or detrusor contractility was observed on urodynamic study. 3-lobe or 4-lobe technique with 8 watts setting was applied. And post-operatively, typically urethral Foley catheter was removed in post-operative day 1, and the post-operative follow-up was done at 2 weeks, 3 months, and 6 months. Looking at the baseline data, the patient average age was about 70 years, and the prostate volume was ranged from 60 to 90, and detrusor underactivity was identified in 4% to 8%, and Qmax was 4.8 to 7.6. And initially, the patient, we put a Foley catheter, and then we try to put the patient on CIC, and the catheter duration was 5 days on acute urinary retention patient, and chronic urinary retention patient, and 3.5 days. CIC duration was 2 days in acute urinary retention group and 2 weeks in chronic urinary retention group. Post-operatively, the Qmax and PVR and IPSS and OAB symptom score was improved very significantly in all 3 groups. But there was no significant difference among non-retention group, acute urinary retention group, and chronic urinary retention group, except in PVR. The PVR was more significant in the chronic urinary retention group, but looking at the volume, their average PVR was volume was 52. That was clinically not significant. Postoperative complication was not that significant. Postoperative 2 weeks, 3 months, and 6 months. The urinary incontinence, urgency symptoms, and urethral stricture or bladder neck contracture was very minimum, and there was no significant outcome difference between among the 3 groups. So in conclusion, our study demonstrated that baseline history of acute urinary retention or chronic urinary retention did not adversely affect the post-operative outcome or complication after Holep in patient with BPH. Thank you very much for listening.
Any questions? Okay, I have a question. As this was a prospective cohort, what was your hypothesis with this study? What did you predict would happen?
Initially, I thought that the patient with a history of urinary retention will not improve after prostatectomy. But in reality, our results showed that there is no difference. Yeah.
Yes. And do you believe that there's something specifically regarding Holep versus other transurethral resection procedures that made that so?
Yeah, the type of surgery, I think Holep is, I think, have more benefit, but I don't think the type of surgery affected significantly. I think the prostatectomy actually the type of surgery did not affect the outcome.
Any other questions? Well, thank you for that presentation.
Thank you very much.